So it's common for us to have cracking joints, whether it's in your hand, elbow, knee. As long as it's not painful or prohibitive from your activities, there's not an indication to do anything such as a cortisone injection. Sometimes things like physical therapy can be helpful in helping with the tracking of the joint, and that's something that we can consider. The things you want to be worried about is if it becomes painful or prohibits range of motion, where at that point in time we'd be concerned about a possible loose body. We would probably want to get more imaging and evaluate you for those things.